internal weaknesses, we had gotten on board already many organizations, but our next step was to start involving some parents and adolescent girls from the population of focus, like I said before. So we know we still need to work on that. That's something we have to work on. It's not clear whatever, we're going to develop something. We don't know what we're going to develop yet, and we don't know how much it's going to cost. So that's sort of an uncertainty we have to face. But our funding is limited. We don't have unlimited funding. So we're going to have to work with that as we move forward. So whatever project you're working on, you would reflect in a similar way about your team and your project. Some external to our partnership, some opportunities that we saw was the Vaccine for Children program exists. It's a federal program that states administer in which vaccines are provided free. All vaccines on the recommended list until age 18 for children who don't have insurance. If they're on Medicaid, it's free through Medicaid. Or if they have insurance but it doesn't cover that vaccine, then they can also get it free through county health departments or many pediatricians who participate in the program. We also were collaborating with the local and state health departments. That was a big opportunity to work together. And opportunities that over the past few years, vaccine rates have been consistently increasing in the national survey data that we've seen. So that's a good trend that will work in our favor. And we felt one opportunity we needed to look at in this pilot that we hadn't touched on our last pilot was thinking about new technologies and how we might use these. Some recent data on media and technology use shows that smartphones, iPods, video games, texting, everything, all those new technologies are actually higher among African American and Hispanic youth compared to white youth. So we think about the digital divide and, do people have access to internet and computers? Really, a lot of the new technologies with higher use in minority communities. So we felt that was an opportunity we might want to think about as we're developing a program. Also, there are a lot of youth activities such as here at Youth Opportunity Center, a lot of organizations working with youth, developing youth leadership, so really a lot of efforts to build upon in the community. Some external threats or concerns that we might have that we don't have control over that are external to our team. There's been some negative coverage in the press about HPV vaccine. We've heard in presidential debates there was negative talk about the HPV vaccine. So a lot of negative attention, not a lot of positive attention, not much positive attention or coverage really at all. We've seen in the data, the national survey data that we now have, that there's a problem of completing all 3 shots. That's a big issue that we need to deal with. And I can share a personal experience. I took my 12-year-old to the pediatrician. They never offered me the vaccine. I said, I want to get the HPV vaccine for my daughter. Okay, sure, you can get it. They give us the shot. They leave. They never once told me I need to come back for a 2nd or 3rd shot. Not once. So if I had known that myself, I would have been among those who only got 1 shot. So that's a healthcare provider barrier that we need to think about. Then there are, of course, the barriers of people coming back and not having time and forgetting and things like that. But even that initial communication with the healthcare provider. Current political environment, sort of some, very controversial issues right now in the news and the media about women's health in general and sexuality, adolescent sexuality. There's a lot of myths and understanding. This was some of the community advisory board members mentioned that they thought might be concerned, some myths and misunderstandings in the African American community about cancer. They said might be an issue. Definitely some barriers in accessing the vaccine, even though it's available free, a lot of people don't know that. So some lack of information, also some misinformation maybe out there that we have to deal with. So that's something that's useful for the team to do sort of at an early stage, thinking about internal and external strengths and opportunities and threats. Next is select your priority population. You may select more than one. You may have a primary target population, a secondary target population, or if you have enough money and resources, you may develop a whole strategy for one target population, another one for a second population. But you need to define that. And if you're going to have a primary or secondary, you may need different strategies for each. So our first thoughts, well, we can focus on the girls, we can focus on their parents, or we might have to focus on both in some way. So what are the sort of the pluses and minuses of doing either one of those? Well, if we focus on the girls, they are the patient getting the vaccine. They are the user here, so they are the person who's going to actually get the vaccine and benefit from it. They might be able to talk with their friends, influence their friends in having a positive attitude about the vaccine and want to get the vaccine. But we don't know. Do they make their healthcare decisions on their own? We don't know. In our previous project, we did focus groups with Hispanic parents. Overwhelmingly, the Hispanic parents told us, we make our healthcare decisions for our daughters. You don't need to talk to them directly, you have to talk to us. We're the ones that will take them, we're the ones that will decide. So I don't care if she wants to get it or not, I'm taking, So that was what the parents told us in that context. So we're not sure yet what we're going to find. For African American girls, some of the community advisory board members suggested we think the girls are going to want to be involved, so we're leaving that possibility open. Again, the parents or caregivers, maybe grandparents, aunts, whoever is the legal caregiver, we're not sure yet. We're going to focus just on mothers or fathers as well, what role they were going to play in the process. But in general, parents and caregivers, of course, are the gatekeepers and primary decision makers for children. So they're very important. Mothers may have some previous experience. We hope they should have some previous experience with getting Pap tests and hearing about cervical cancer and knowing that that's an issue. We're not sure yet if parents want us just to focus on girls or they want us to have the messages focus on boys too. Now the vaccine is approved for boys as well. Of course, cervical cancer only affects women, but the vaccine also can prevent some types of cancer for men, anal cancer, other types of cancer for men as well. And it's a sexually transmitted virus, so that's why both would need to could get vaccinated, but the CDC is sort of taking the approach that it's more cost effective to focus on girls. While of course it'd be great for everyone to get it. If we need to really invest resources into promoting it, they're focusing on girls, so that's something to think about. So then you can go through the same kind of return on investment thought process in selecting your target populations, the same way we did for selecting behaviors. This is what we thought about when we were doing the first project with Hispanic girls. We said, well, we could focus on healthcare providers. We just talked about how healthcare providers may or may not recommend the vaccine. They may or may not actively remind you to come back and get them. So we thought definitely there's a big potential for impact there because parents and families really care about what their pediatricians say. They usually will do or follow recommendations of the doctor. Studies have shown that doctor recommendation is the biggest predictor of whether you get a vaccine or not. So we knew there's a big impact, but likelihood of adoption, we're like, well, it's kind of hard sometimes to change doctors, what they do, and that might be a little harder to actually accomplish some changes. And also, like I said, we have another project going on through Meharry where we will be focused on healthcare providers. So we said, well, maybe we'll just leave that for the other project. And then we looked at girls and parents. So for girls and parents thought the impact would be high. Either way, there would be an impact on whether they get the vaccine. But we felt like likelihood of adoption, the Hispanic parents had told us, you're wasting your time talking to daughters because we decide. I don't, what they think, we care what they think, but overall, in the final analysis, we're the ones who decide. So we felt like the likelihood of adopting the behavior was highest for parents for this target group. So that's where we felt like we had the best balance between impact and likelihood of adoption. So for our new project, we're exploring this right now. We're getting ready to start collecting focus groups and interviews, and we're going to be looking at, should we focus primarily on girls, should we focus primarily on parents and caregivers, or some balance of the two? So we're going to be deciding that as we move forward. Because you can imagine focusing on girls versus parents, your strategies and your messages are going to be very different, right? How you reach girls versus how you reach parents is going to be very different in what you say. So that's important to decide before you start the rest of the other steps. So you see 1 through 4 here are sort of in a little clump here. This is not necessarily a linear process, especially in 1 through 4. This may all be happening at the same time. It may be happening continually even as you go through the rest of the process, but they are sort of things you need to start with, and then you may keep working on them as you go along. So building community capacity is also important. So in your partnership, we have people from different organizations, maybe community members who don't have a lot of experience with the issue or know a lot about the topic yet. So it's important to assess what the needs are for ongoing training, capacity building in your partnership. For example, trainings like this. We did this training for our community advisory board last month, and we'll be working with Carol Bright when she comes to work more in depth with her as well. So this is an example from the National Latino Health Coalition. We did a social marketing training for the coalition when we were working on this. And then also training community members when you start going out in the process, either collecting data or developing and implementing the program, there may be opportunities for community members to be involved as part of the team, either as collecting data or implementing, delivering whatever program you develop. So keeping that in mind as a option is very important. So we don't know yet what we're going to develop and what the opportunities are, but for the Hispanic project, for example, and I'll talk a little bit more, but the person who delivered that intervention was at an employee of Progressive Community Center. We trained her to be the key person doing the intervention. So that's an example of what you can do. So next, after you get sort of those preliminary planning steps done, then you need to look at what data you already have available, such as those national survey data that we looked at, other studies that may have been done, other projects that may have been done in other places, or your own experience in this community. See what we already know, and then what are the gaps in knowledge? What do we not know about yet? So when we looked at what we know so far about HPV vaccine and African American girls, well, we had the survey data. We knew there was a problem with both starting and finishing the vaccine. But we didn't know yet much about people's attitudes. There have been a few studies about it, but we wanted to know more about knowledge, attitudes, and behaviors related to the HPV vaccine. And also start breaking down African American community is a very big, diverse community. Parents and daughters can have all sorts of different attitudes and positions about the vaccine. So we wanted to start dividing up, segmenting that big group into some subgroups or market segments to start focusing more specifically. So like when you see advertising on TV, you can tell when a commercial is targeted towards young men or old men, say the Viagra commercials. You know who they're targeting in that commercial, right? Or beauty products, you know who they're targeting. So they don't just make commercials for all women, right? They are very specific on who they're targeting in commercials. So it's sort of the same idea. So we're going to be using some focus groups and some individual interviews with parents and girls in our age range. We're also going to be looking further into the National Immunization Survey data, looking at some of the patterns about whether the girls have gotten no shots, have gotten one shot but not finished the series, if they finished the series. They also asked them if they haven't gotten the vaccine, how likely they are to get it. So we're going to be looking at breaking down the population into some subgroups and seeing some differences in patterns and what the characteristics are of those different subgroups. And also looking at other research that's been done and what we can learn from that research as well. So we're already thinking about some potential market segments, so how we might want to be breaking out our target group into some separate segments. So like I said, we're going to be breaking it down, first of all, by vaccine use, the actual behavior so far of using the vaccine. We'll be looking at one group that's already completed the series of the 3 shots, another group who started but hasn't finished it yet. We'll be looking at why they haven't finished it yet. Another group who has not gotten the vaccine and has said, we do not plan to get it, we don't intend to get the vaccine, so they're basically rejecting the vaccine. And another group who has not gotten vaccinated yet, but just not that they decided not to, they just haven't gotten it yet, and they may just still be thinking about it, they may be undecided. So those are our potential market segments we're thinking about so that's how we're breaking down our data collection. Part 2 of this series in May 8th, mark your calendars, 11:30 to 2. It will be here as well. We will have Carol Bryant from University of South Florida, and she will then come and go more into depth about the process of developing a marketing strategy and really benefit from her expertise and her veteran experience in that area. She's a very well-known leader in this area, so we're so excited to have her come. And she's a consultant working with us on these projects.